The Greek government acted decisively in the first wave of the pandemic, and as a result, we experienced 6 to 7 months with the virus suppressed within the Greek territory. Since then, as in most other countries, we have seen two new waves, and we're now seeing the fourth wave of the pandemic. And as other countries, Greece has tried to do its best to contain the spread of virus in the country. Did we perform well compared to other countries? That's a difficult question to respond to, because we need to take into account a number of variables. The demographic situation in the country compared to other countries. Just to give you an example, a very concrete example, if we compare Greece to Turkey, for example, we have 22% of our population who are over 65, compared to 9% in Turkey or 11% in Israel. So therefore, when we will evaluate the performance of the Greek government vis-à-vis other governments, or the performance of the country vis-à-vis other countries, we'll need to consider the demographic structures of different countries, the epidemiological patterns, the number of people suffering from comorbidities and chronic conditions, as well as other factors. For example, health system resilience, funding of the healthcare system, and the possibility of the healthcare system to respond to the pressures of the pandemic. We need to consider population density in different countries, and also conditions in the working place, the number of people in teleworking, the composition of the households. In Greece, we have a significant number of households with 3 generations. For example, more than 16% of the total number of households are 3-generation households, compared to 3% in Sweden. So to conclude, it's not going to be an easy comparison, comparing Greece to other countries. So we need to have a significant number of data, and we'll have a much better perspective, possibly at the end of next year. We have some encouraging news from Pfizer and BioNTech regarding the effectiveness of their vaccine to address the challenges of the Omicron strain. However, the data has not been published yet, so we'll have to wait to see the full set of data published in a credible academic setting. But I will repeat, the press release issued by Pfizer and BioNTech is very encouraging. However, we always compare experimental data with epidemiological data and clinical data. So we'll have to evaluate the number of admissions to hospitals and the outcomes of hospitalizations, and compare trends in the Omicron variant to the Delta variant. So it's still a bit of early days, I would say. So we should be a bit patient for another 10 to 15 days before we are able to draw conclusions about the Omicron variable.